Hello, welcome everybody to tonight's Fund a Fellow, Living with Parkinson's, What to Expect. Sorry for a little bit of delay. We had a few technical difficulties, but I think we have a great program scheduled for today. Today marks the first time that we get together in this new academic year for Fund a Fellow. I want to thank everybody for being with us to continuing to educate our future movement disorder physicians. It's a great honor and a pleasure to be with you all here today. Our mission has always been to enhance the care of individuals living with Parkinson's and helping their caregivers and their partners who have Parkinson's to get the best care possible, to advance not only the care, but also the research and the treatments available for Parkinson's disease. And we continue to do that. I want to thank the development team at Georgetown University Medical Center for their support over the years doing this, and to the original co-founders, Mr. Rick Shenna and Ms. Janice Buchanan. So thank you all so much for all the support over the years. So today we'll have a panel discussion about how we live with Parkinson's, and I'm very honored to be able to have Mr. and Mrs. Shenna. So we have Rick Shenna and Donna Shenna who will join us in this panel discussion, and we'll also have Ms. Joyce Peavy. I'm not sure if Mr. Peavy will be joining us, but we'll be talking with our panel throughout the course of this evening of how we live with Parkinson's. So I want to first start off with I'd like to get a viewpoint from a patient's perspective and from a spouse care partner's perspective. When you think about Parkinson's, what are some of the first words that come to mind, in your mind? So so let's first start off with Mr. Rick Shenna. When you think about Parkinson's, how would you tell, if you told somebody I have Parkinson's disease, and what if they said, well, what is that? How would you describe Parkinson's?
As an inconvenience, truly. For me, I've had the disease. You diagnosed me about 15 years ago, and I know prior to that I had things going on. As I've watched the progression of this disease, I find it as something that I can deal with. And like I said, it's an inconvenience. I think I'm stretched to find a word or a phrase that would encompass what it means, because it's such a different disease to every individual that has it. And I know that. I speak with a lot of Parkinson's people that have Parkinson's, and they've all, when we share our feelings and what's happening, it's all so different. So for me, I don't think there's a catch-all for it. But it's something in motion all the time, movement.
All right, so it's very individualistic. So Mrs. Shenna, so if somebody asks you, well, I heard you have a family member with Parkinson's. What is Parkinson's?
So, I would go into the explanation of what Parkinson's disease is. I mean, Richard and I, so if you know one person who has Parkinson's, you know one person who has Parkinson's, because as you said, Dr. Pagan, it's very, very individual. And so that's really the message when I talk to people. So from the beginning, when Richard was diagnosed, we were very open about it, because when you hear it, it's like, what? And so it really is about change and adjustment, but that's life. But so learning as much as you can about the disease, learning about the progression, but understanding that each individual progresses very, very differently than someone else. So you can't own what somebody else is sharing you, but you can learn from that and learn about the adjustments that you need to make in your life.
Mrs. Peavy? So,
hello.
Hello, it's so nice to see you. Thank you again for all the wonderful panelists. They've been great supporters of Fund the Fellow throughout its inception. So, how would you describe to somebody what Parkinson's is? I have Parkinson's. What they don't understand what it is. What would you say?
Being a nurse, I tell them that it's a brainstem disorder. And the brainstem is the controlling factor or the control center of your body, which means it controls all the muscle movements. It controls everything, temperature, mental, emotional. There's so many factors that are controlled in Parkinson's. And I think when I've talked or been asked to talk to people, people are afraid. And I have found that it's not to be feared. It is to be managed. It's like any chronic disease. It is manageable. You just have to know what your symptoms are and how you react, and to relay that to the physician so that he can help you with the medications.
Okay. And is Mr. Peavy there?
Yes.
He is.
He is there. I get to see you. Hello. Welcome.
How are you?
Good. Nice to see you. So let's say a friend or a family member asked you, I heard you have a spouse with, or you have a family member with Parkinson's. What is Parkinson's? How would you explain it to them?
Well, I think Joyce and Richard and Donna actually have really said it well. It is not something to be feared. It is an inconvenience. But I think the natural instinct is for people to be fearful of what they don't know. And so education, learning, being aware, conversing with your doctor, talking to other people who have had experience will, I think in my mind, will quickly erode a lot of the ignorance that may help shape an initial feeling about Parkinson's and allow one to begin to understand that it is a progressive disease, but it is one that can be managed. And probably for me as a caretaker, it's the realization that this is not a static disease. As Donna pointed out, when you've met someone that's had Parkinson's, you've met one person with Parkinson's. But once you've met that person with Parkinson's, the disease with that individual is not static either. It evolves, it changes. And so it's one of the issues in my mind that as a caretaker that we have to be aware of and work with it as it progresses.
So a common theme that I've heard from all of you is that knowledge is power. Knowledge is power. And I think that is very, very important in Parkinson's. I think all four of you have said it in your own way. And that is so important. How about we talk a little bit, and also that this disorder is a slowly progressive disorder and it's manageable, and there's medications that can definitely help improve your quality of life, but there's more than just medication. So let's go to back to Mr. Rick Shenna. And what are some of the things that you do to help modulate your disease? We can always talk about medications later, but what are some of the things that you've learned that helps you? Again, every person is different. We've heard that theme again. One person with Parkinson's, one person with Parkinson's, and we'll go into some of the symptoms that different Parkinson's patients have. But what are some of the things that you do that you've learned over the years to modulate this disease?
Well, that's a great question. Just recently, I was talking with one of your colleagues, Dr. Musa, and he asked me. He says, "How many years have you been diagnosed with Parkinson's?" And I said, "Yeah, it's somewhere around 14, 15 years that I've been dealing with Parkinson's as far as a diagnosis. I know that earlier, a couple of years prior to that, I knew something was not right in my body and things were going on." And he asked me, he says, "Well, how do you deal with it?" And again, that was the great question. And it comes down to 3 or 4 things. One is good medicine. I mean, I'm very, very fortunate that I have available to me great medicine. 2, I'm very, very fortunate that I've got a caregiver that's there that watches over me like an angel all the time and lets me know when things are changing, because some things change and you don't realize they're changing, but somebody from the outside sees that. The other thing I would say is a good attitude. I have Parkinson's. I accept I have Parkinson's. I consider it an inconvenience. So the things I do is I work through it. There's times that I do feel lethargic. There's times that my body slows down, my movement slows down. I just try to work harder to work through that. I try not to dwell on the notion of Parkinson's. I think my first few years that I was diagnosed, I thought about it every minute of every day. Now I think about it occasionally. It's just become part of me. And there's things about it I like, and there's things about it I don't like. And when I say things about it that I like, you say, well, what is there to like about Parkinson's? For me, it's allowed me to do so many more things in my life that I never thought I would do. And I find that a real positive. So when you can take a negative and turn it into a positive, you've done yourself a great favor, and you've done a lot of other people a great favor.
And Miss Peavy, what are some of the things that you do to help you with Parkinson's? What would you recommend to somebody who is newly diagnosed? Oh, well, these are some of the things we heard. Some of the positivity that Mr. Shenna has. How about you as an individual? What kind of things would you encourage somebody else who recently got diagnosed with Parkinson's?
Humor. When you kind of make a mistake or you have a tremor or something happens, you make a joke about it. I agree with everything that Richard says. You have to make peace with yourself about your disease process, and you have to accept it and live within the parameters that you have. You can't change any chronic disease. So that, to me, kind of frees you to be who you are and unburden yourself. And it also helps your caregiver too, because it makes you feel better and more it just is so freeing.
So now I have a question for the care partners. What are some of the things that you do as a care partner to support your loved one with Parkinson's? What things do you find that really help? And what would you say to other individuals who may have a partner with Parkinson's? Well, these things are what help us as a couple. Well, so what kind of things would you recommend to care partners? What's important for you as a care partner to help support your loved one, and things important to help you as well with this disorder as well? And we'll start off with Ms. Donna Shenna.
Thank you, Dr. Pagan. I think the first thing is to deal with the fear of the unknown, you know, when the diagnosis first comes on, is that, you know, it's scary, you know, because you don't know, but it comes back to that education piece of, you know, learning about the disease, understanding the broad concepts of, that it's chronic, that it's progressive. For Richard, for me, it was what could we do? How could we become involved, you know, in the community? You know, Richard and Janice got involved with you, and Georgetown with Fund a Fellow. I got involved with the local organization called Parkinson's Foundation for the National Capital Area to try to make a difference. But I would say, you know, recognize, own the fear, own the challenges of what you hear. But I also think just paying attention to your partner, and not just together, you know, recognizing what's going on, and watch and pay attention and talk about it. Richard and I talk about things. Do we talk about it all the time? Not anymore. But if I see something going on with Richard, I will say, hey, you know, I mean, I can tell when he has rigidity. I can tell when he's got rigidity going on. I can tell when his energy level is low. And so we talk about it. We don't dwell on it. We move on. And for Richard, I mean, he's a fighter just naturally. And so I get my grace and my strength, you know, also, you know, from him, and dealing with what we know, and also recognizing there are things we don't know yet, recognizing that, but not dwelling on that, dwelling on today, what we're going to do today, what are the things we can still do, and also recognizing that at our age, we're having some impact that isn't from Parkinson's necessarily. It's just the, you know, the blessing of being able to get older. Richard will say, I've got this. And I'm like, you know, honey, I got that thing going on too. So that would be what I would say to people.
Mr. Peavy?
All of these are wonderful answers. The best I can do is probably say that in Joyce's, in my case, communication with each other is extremely important. Communication is important in any marriage for it to be successful, because we evolve in our lives and in our marriage. But when you pick up a chronic disease, that communication takes on a different dimension. The importance of it, I'm not going to say is more important than communication during a regular marriage with no disease in play, but I'm going to say that it's helpful because if you have a relationship that is built on trust and sharing your experiences, the caregiver gets an opportunity to be able to understand how the person affected most by the disease feels. That gives you clues on how you can step in and assist, because you have to find your role as a caregiver. And you have to be careful about it. You know, I've overstepped my boundaries before, you know, attempting to be overly helpful when I didn't need to be. Joyce is an extremely courageous person, and her courage feeds on me, because I see that she deals with this with a lot of humor. There are moments when she's down, and the expectation, I think, at that stage is for me to be as uplifting as possible, to be encouraging, but to watch and pay attention to what's happening to her, so that if I do notice changes, much as Donna has indicated, you're in a position to be able to help. And I agree with everything that was said before, in that the work that you have to undertake, both as a person having the disease and as the caretaker, is loaded up front in the experience. As you learn about this, the disease begins to take a little bit of a back seat. You begin to live your life. You begin to find your things. We're sitting here in Key West on our private bus. We're in year 8 of the disease, and it is not stopping us from living our life. And Joyce wants that. And it's also helpful to have Dr. Pagan encourage us to get on the bus and go find, sunlight and warmth. But those are the things that I think are important.
Yeah, so this is living with Parkinson's.
It's living with Parkinson's.
Exactly. And I think everybody has said it in their own way. I think it's a very scary diagnosis to get at the beginning, but knowing that there are things that we could do to modulate the disease, that we can continue living with Parkinson's. And I think we heard it from everybody about the different medications, about the different therapies, about the different exercises. But once we remove that fear, we can live with Parkinson's, and we can have very productive lives with Parkinson's. We can have very fulfilled lives with Parkinson's. There are going to be bridges that we have to cross along the way. There's always, and the good news is that we really are making a lot of headway in the disorder. And I can tell you, as a movement disorder neurologist, the medicines I had, 10, 15 years ago, they've quadrupled in availability. We've learned how to better treat a lot of these symptoms, and it's not just one drug. And there's a lot of different medicines that can be helpful. There's a lot of different chemical imbalances that occur in Parkinson's, and we have a way to modulate them all now. It's very amazing. And who knows what the next 10 years are going to show. I think we're very close to having truly disease-modifying therapies in neurodegenerative disorders. And I think in Parkinson's and Parkinson's-related disorders and just neurodegenerative disorders in general is first understanding what that disorder is, so that we can continue to live with the disorder. But we can live with Parkinson's, and we can do a lot of different things with Parkinson's. And that's what so far, it's been all music to my ears from hearing all the different panelists. Now, for the care, I want to hear specifically from the care partners. What would you say to a newly diagnosed care partner? So, a care partner who has a loved one. What's important is, what have you learned to do? Because I always tell patients that it's a disorder that affects the patient, but I think it affects the spouse equally as much. And that person can undergo a lot of stress. So what would you recommend as things that you can do as a care partner to reduce your stress and make sure you continue to take care of yourself? So what are some of the things that you've learned as a spouse, a care partner, that's important? And we'll start off with Ms. Shenna, then Mr. Peavy next. Yes.
Don't stop living. Address the anxiety. Talk about it. Talk about it with your partner. Spend some time thinking about what kind of support you may need. There are support groups widely available in the Washington, D.C. metropolitan area. Some people need the support group, some people don't. I've called upon my family of friends, to give me support. And just, the communication piece that Bob talked about is you have to talk about it. I have to be able to say to Richard, this scares me, or this concerns me, or what are we going to do about this? I will say holding in those anxieties does not help at all. In fact, I think it really, really creates a barrier. But talking to people and friends who don't know of the experience of being a care partner of someone with Parkinson's, but also talking to those who do. And like I said, the education piece and knowing what's available is so very, very important. And so I would say, finding out what's out there. When Richard was diagnosed, I shared immediately with where I worked that, Richard was diagnosed with Parkinson's. And that helped me, because I knew if perhaps I was having, a rough day, they might, be a little bit understanding. And the gift and the joy that I got from that is that over the past 15 years, I have had individuals that reached out to me where I worked to say, my partner has been diagnosed, I've been diagnosed, what can I do? And, you know, to be able to touch someone that way and have them reach out to you so that you can help guide them is so very important. So for me, for Richard, you know, just letting people know, hey, this is what we've got going on. Some people don't want to do that, and I understand that. But it really worked for Richard and for me.
Thank you. Mr. Peavy?
Joyce made it very clear when she was diagnosed that she was going to share the fact that she had Parkinson's with her friends and with other people. That was helpful to me as a caregiver because it let me know that the boundaries that she had established were pretty wide open. She wanted to be able to understand the disease, and she was going to live with it. She was going to try to manage it as best as she could. But the fact that she was willing to share it and the experience with other people gave me the green light to be able to be more open as well. When you try to hide it or be restrictive about what you're experiencing, I think that it doesn't enable all the opportunities to get assistance and to be able to benefit from the experience, as Richard had talked about. I also would say that one of the most important things for me as a caregiver is learning to pace myself. A caregiver can go full bore into the caregiving role and wear themselves out pretty quickly. And you find yourself not being able to sustain that rhythm or that pace. You have to be able to help the person that you are living with, but you also have to help yourself. You have to give yourself time. You have to have some private time. You have to be able to engage in the activities that you like to engage in, understanding that there are clearly some restrictions about, you know, distance and the amount of time, because you have to be, you know, available to sort of shift quickly if you need to. But it's important to be able to find that time for yourself and to manage it. And it's been said before, Joyce used it, humor, one of the most powerful tools, you know, in the toolkit. Find ways to be able to joke about the disease and the experiences, because what it tends to do, it tends to relax everybody. And when everybody around you is relaxed, it brings you to a level that is far more able to be sustained comfortably and freely, not making the disease sort of control you.
And I think all of you have said this so eloquently, you know, how to live with Parkinson's. And I definitely would be great to take any questions from people in the audience. But you know, one of the things I often ask in my clinics, because I want to make sure that our patients and our care partners are living with Parkinson's. So one of my favorite questions to ask at pretty much every visit is, what are you doing for fun? We got to keep having fun, you know, and that's the purpose of taking all these medications. That's the purpose of doing all these exercises. We got to keep living. We got to keep having fun. And this is so important. I think if the pandemic taught me anything, is how bad isolationism and not moving is. You know, so I probably saw more deterioration in our patients with neurodegenerative disorders during that 3-month period of isolationism that I've ever seen in my whole entire career. You know, so this really taught me the brain health is so important, and having fun, being social, exercising, that is all part of brain health. And it was probably one of the worst sociological experiences ever. By isolating everybody, we saw the deterioration of brain health during this time. I don't think there's one clinic in America who didn't experience this, you know, so, and we see this just in our own families, et cetera. So So one of the things that, I've learned throughout my career for part of brain health is how important movement is. So movement and exercise, we see how important that is in slowing down the disease progression, but we're also seeing that is also important in other neurodegenerative disorders. So it's not important only for Parkinson's. Parkinson's is probably the one that taught us all about it, but we're seeing the same studies in Alzheimer's disease. We're seeing the same studies in Lewy body disease, vascular dementia, et cetera. So all of these different neurodegenerative disorders, having social interactions, having physical activity is extremely important. And that's what our medications are all about. So our medicines are so that you can continue to live your life as functionally as possible, but enjoy it. We need you to enjoy your life. So what I do hear from our patients and their care partners and their caregivers, that they just went on a trip. They just traveled down to the Caribbean, or they went down to Florida, the Keys, or they went on a weekend escape to the mountains of West Virginia or the Shenandoah Mountains. That's music to my ears. We're living, and that's what the purpose of this meeting tonight is all about. Is we have to find ways to live with Parkinson's. If we're not living with Parkinson's, we're missing something. Are we missing a certain medication? Are we missing a certain symptom that we're not adequately treating? And that's the importance of having that relationship with your healthcare provider to really make sure that we treat the right symptoms so that you can continue to live with Parkinson's is so important. As patients, what do you think is the right amount of time to see your neurologist? So I want to get your viewpoint for it, and we'll start off with Mrs. Peavy. So what do you think is the right amount of time a year? How often if somebody again was diagnosed with Parkinson's, what would you recommend to make sure that they keep contact with their healthcare provider to manage their Parkinson's?
I think initially they may need to see you more frequently because they need the education and they need to feel secure in the knowledge that they're getting. And so I would say probably every 3 months. One of the things I needed is to be able to, if I had a problem, to call in and to get an answer back because I didn't know. And that might be, you might be able to elongate a visit by having a phone conversation. And it also makes people feel more secure in their health care and if they are being taken care of. So 3 months, I think, is a good time frame.
Stretched as you get more experience.
And stretched as you get more experience.
Okay. And same question to you, Mr. Rexena.
Well, I actually don't want to see you very often because I have dystonia, and one of the things that we do to help me is to give me injections of Botox, and you can see they're going to the wrong places. But in all seriousness,
and he does share.
Oh, Richard.
I do have to go in every 3 months though, and do get Botox. And let me say this, it has been a game changer for me. I was in so much pain. I was at a point where I could barely walk because of the muscle spasms that I was having caused by the dystonia. and Dr. Bagan has taken this to a new level for me, and it's made a big difference. So I actually look forward to my visits to the clinic. I look forward to seeing Dr. Bagan. There's always wisdom there. He carefully goes through the how I've been over the last 6 months since the last time he's seen me. It's an opportunity to work with the fellows and to pass information on to them. I feel because of Fund a Fellow, I do feel like there's this response. I have a responsibility to them to be the best patient I can. And being the best patient isn't always very easy thing to do. But I do prepare for my meetings with Dr. Bagan. Donna does. We talk about what we would, any changes, anything that we see. So yeah, right now I think if it wasn't for the Botox and having to have the injections, I think right now I'm very comfortable with 6 months, or even doing a video conference call with the doctor and the fellows.
So so I think that brings up some terrific points there. So definitely, I think that's one of the benefits of having a fellowship program, is that we can do visits a little bit more frequently because we have more help in the clinics, but also we're also teaching them at the same time that Parkinson's disease is not only just a motor disorder, but there's a lot of non-motor symptoms as well. There's a lot more than just a pill that you have to give. So all the different ways to be able to treat them. And I think that's our fellowship program has also allowed us to foster a lot of not only educational atmosphere, but a research atmosphere as well, and enhance our clinical our clinical care as well. So that's one of the huge benefits of having a fellowship program. I want everybody to write their congressmen to keep the video conferences, the teleconferences available. So they're taking it away from us, unfortunately. And I think the pandemic's not over, but it's terrible when you're given a tool that helps so many different patients, and then it's taken away from you. So this is something that's happening again. So they're only allowing video teleconferences for psychologists only. So no MDs. So this is we got to wake Congress up. This is it's been such a useful tool. Of course, I think we can never replace the physical talking to somebody, but I think it brought an excellent tool to be able to keep in touch with our patients. So if our patients were down at Key West, or they were several hours away, we could do something in between, and they didn't have to hop in a car for 6 hours, 8 hours, or a plane ride for 3 to 4 hours. So I think this is something we definitely are going to have to continue to lobby to get back because it's being taken away from us, unfortunately. But it has been a terrific tool, and actually I still continue to use it because it's sometimes being able to see somebody rather than just listen to them on the phone makes a world of difference. So I think that's something we'll hopefully change back again over the next several hopefully over the next year or so. But video teleconferences were about 10 years in the making. It was all only research and fighting all this red tape, and then overnight everything was taken away. We have full access to it, and then now all the red tape is coming back. So it's really unfortunately it is a problem with insurance coverage. So their insurances are. It's funny, they advertise on television that's part of their plans, that they have that, but yet they won't cover it. So it's kind of weird. Insurance companies, they're a different animal, but that's not what this is about. So we won't get into that. So, but these are definitely tools that we have, and getting to know your patients over time and really figuring these things out. One of the things I wanted to share with everybody was, that a lot of times we think about Parkinson's just as a motor disorder, but I definitely we did talk a little bit about this through this evening. We know that in Parkinson's disease, this misfolded protein that accumulates in the brain is not only where the dopamine neurons are, it's really more diffuse throughout the brain. And we could have different types of, we can see depression, anxiety, difficulty with thinking. We can have sleep disturbances. We heard about pain. Dystonia can be very painful. And a lot of people don't put that the pain is part of Parkinson's. And sometimes that could be a presenting symptom. And there's a lot that we can do for you. And I always talk to our fellows and medical students that we could probably make the diagnosis of Parkinson's a lot sooner if we hung out with our orthopedics or rheumatologists, because a lot of our patients go first because they're having shoulder pain or calf pain or back pain or neck pain. They're seeing other doctors and they're not recognizing that this is a rigid muscle that's constantly contracting, building up cytokines and lactic acid and pain. And there's a lot that we can do. And then the constipation, the blood pressure problems like the lightheadedness, the dizziness, the lack of energy, the increased frequency and urgency, the sexual dysfunction, the drooling. So these are all parts of Parkinson's. So it's not only a motor disorder. And sometimes what we see is that this disorder is present years before. And we heard Mr. Shenna talk about that by the time we've made the diagnosis based on the motor symptoms, there's other things that have been going on for some time. And these motor symptoms and non-motor symptoms will continue to worsen across the disease. And most patients with Parkinson's are going to live, easily 20 years plus in today's world with this disorder. And we have to treat both the motor symptoms and non-motor symptoms. And the one thing that I think as a practitioner that I have learned over the years, what I have learned is that we are modifying the disease with our treatments, but we're also modifying it by our activities. So the more active we can be, the slower this disease is going to progress. And again, that all goes along with brain health, as we were discussing about. And that's why the pandemic, I think, was so detrimental. The other thing is, I think here at Georgetown, we've been motivated by our patients, and Fund a Fellow has been such a huge motivation for us in the movement disorder program, and we've been able to train so many movement disorder specialists. But at the same time, we've been able to also think about the future about delivery. And in meeting with Mr. Rick Shenna and Ms. Janice Buchanan, we came up with a new center, a Center for Neurodegenerative Disorders, a CND, a place where we can redefine brain health. One of the things that we started to do is we started to have a clinic where we evaluate cognition on every single Parkinson's patient at least every year. And we've seen that our medications make a huge difference in cognition, in speed of thinking, and also in retrieval. And we use these medicines, and not only do they improve memory, but they also reduce falls. So we're not waiting for our patients to start falling and have memory problems anymore and be reactive. We're being proactive about it. I always thought about if I was a stroke neurologist, I would want to treat people before they had the stroke, not after they had the stroke. And that's where I envision this Center for Neurodegeneration going in the future. let's identify the risk factors and let's modify as many factors as we can to improve brain health in our individuals so that we can modify the disease. But then there's certain people who may have certain risk factors. And then when we start treating and improving that brain health in those individuals, maybe we'll prevent them from having dementia or Parkinson's or et cetera. And I think that's where the future of neurodegenerative disorders are. But I think there's things that we can do currently as movement disorder neurologists to improve the brain health of our individuals who have Parkinson's and Parkinson's related disorders. So I'm proud to announce that we do have a Center for Neurodegenerative Disorders, the redefining brain health. So it's going to call the C&D. We're going to be across the street in McLean where we are. This is going to be devoted to that. And our hopes right now, our opening date is the first week of February. And it looks like everything's on target for that first week of February. So more to come on that. I want to thank everybody for funding the fellowship program, because I think that this has really put Georgetown, especially the Georgetown Movement Disorder Program, in a different level. We've seen the translational neurotherapeutics program. We've seen the research. We've seen where we've gone. I want to thank our esteemed panelists for teaching us how to live with Parkinson's, the keys to living with Parkinson's, getting on the right medications, continuing to live. That's what we have to do with Parkinson's. We can live well with Parkinson's. And I hope the future, what we could bring for the future for individuals with Parkinson's, for the caregivers with Parkinson's, and also for future patients, is to learn how to improve brain health and to hopefully prevent and change the course of these diseases by improving brain health sooner rather than later. And I think that's where we're headed with the C&D. And for our last few minutes, I want to open it up for Dr. Torres Yagi to just close up the program. Thank you, everybody, for joining us. Sorry that we started a little bit late, but Dr. Torres Yagi can finish it up here to just talk a little bit about, why the fellowship program is important and what he looks forward to with the C&D in the near future. So Dr. Yagi, take it away. Thank you, everybody, for joining us today. You're on mute, Dr. Yagi. Yeah, okay.
How's that?
We can barely hear you, but keep going. Yes.
Is that okay with the sound?
You're very low.
Hold on 1 second.
Now we don't hear you at all.
How's that?
Perfect.
Oh, sorry about that. I was listening to the wonderful parts about virtual care. The microphone and the technical glitches is not one of them. I'm sure everyone can understand that through the past year and a half. Thank you for having me, Dr. Pagan. Learning during my fellowship for Fund a Fellow, even before I was a fellow, when I was a resident, I went to my first Fund a Fellow meeting, and I still remember everything that I learned prior to actually becoming a fellow. And part of the reason I fell in love with the field was because I really, really enjoyed getting to meet everyone that is still here today, joining these Fund a Fellow meetings. I have to tell you, I wouldn't be here today without Fund a Fellow. I don't think I would have been able to continue learning, subspecializing, becoming a comprehensive movement disorder specialist under the leadership and teaching of Dr. Pagan. And I've learned so much from everybody here. I take a look at the list of people and getting to see the Peavies and the Shennas. It really, this experience through my fellowship really made me the doctor that I am today. And I can't imagine having done it any other way, because the reason why I feel like I have such a comprehensive training and why I can give good care to my patients is because I learn so much from everybody. And Mr. Shenna said it earlier, it's kind of what we're doing during the fellowship as fellows is really letting it all sink in, taking it all in, trying to be present during all of these meetings, trying to listen, learn from Dr. Pagan. You know, everything we hear from him, you know, sometimes he says something, you know, in the hallway, and I'll poke my head out of my clinic room. I said, I didn't know that. And he says, yeah, you know, you didn't hear about this one thing. I said, no, oh my goodness, thank goodness. I should go back to fellowship. But what I can tell you is that we listen and we learn from our patients. And I've listened and learned so much from all of you. And because of all of the different ways of hearing and absorbing all of the information you have all given us, and I know the fellows feel this too, because when we meet, I can't tell you, I think this is one of the most advanced and comprehensive fellowship programs in the country. We get to meet a lot of the fellows in the country. And what I see is that because of the way we approach our patients, both diagnostically and therapeutically, and from a non-pharmacologic way, it's a positive and optimistic experience. And that's what I want us all to leave here today, kind of feeling hopeful, positive, and optimistic, the same way that we like to practice with that hopeful optimism. It allows us to really enjoy every single moment of our day and our career. And to culminate all of that enjoyment and positivity will be the Center for Neurodegenerative Diseases. I know that Dr. Pagan, this has been almost his lifelong journey, you know, to create a center like this. And I've been able to jump on the train, you know, because of Fund a Fellow and because of where I am in my career to be part of this movement. But it really is going to be a movement. And we are going to learn how to create this sort of augmented, optimized brain health approach that I think will be second to none. And that sort of optimism, I think, will remain in us as clinicians, and hopefully will be part of our patients. All of our patients hopefully will feel that optimism as well. So thank you very much. I know we're over time, but I really, really appreciate what everyone's done for me and what everyone is doing for the fellowship and for all the fellows that will be subspecialized in movement disorders and be able to go all over the country taking care of patients.
Thank you again to all our panelists, and I hope everybody has great holidays. Everybody who's enjoying Hanukkah right now, Merry Christmas, Happy New Year. I can't wait for 2022. I think it's going to bring some exciting times. There's a lot of great things to come. We're working hard behind the scenes to help improve the clinical care, the education, and the research for all our patients and their caregivers. So God bless, and we'll see you next time. Thank you so much for being with us. Bye-bye.